A specialist in sports medicine has a specialized education and training which focuses on the medical and therapeutic aspects of sports and physical activity. We went to Pomona Valley Hospital Medical Center and spoke to Dr. Duane Styles about sports medicine.
All medicine is sports medicine because there's nothing that's going to happen to your patient that shouldn't have something to do with exercise and diet and nutrition, and I consider that all part of sports medicine. And so we see the full gamut of people that want to come and start a walking program, people that want to start a weekend warrior program. We get very aggressive activity, and then we see all the subsequent injuries that come to our sports clinic after that. So everything from bumps and bruises to broken bones, we see the whole concussions, unfortunately. So we see the whole gamut, sports medicine, from little kids to, I had a lady in her 9th decade that was still doing triathlons, if you can believe it. So we see the whole range. It's a lot of fun.
Dr. Styles examines the education for this specialty.
Our program is quite different here because it's really based on an educational platform to teach family medicine residents. So they get to learn by doing sports medicine in our clinic. So they'll see the patient and I'll go in and see the patient with them. And we have somewhere between 2 and 3. This year we have 5 residents out of 18 that are in my sports track. And I like them to be with me for 2 years because sports medicine takes a little longer to learn. I think there's a lot of hand skills that have to be learned as well as book knowledge. So for 2 years they're with me, and that's the big part of my team. And then I have graduates of the sports medicine program and the residency program here at Pomona Valley that have now become part of my faculty at the residency program. And we are team doctors for local high schools.
The doctor gives his advice on how to avoid injury when playing sports.
Technology in sports injury, I think, for head injury, unfortunately, is not there. Pretty good evidence that mouth guards don't help. Helmets really don't prevent concussion. They're trying to do a lot of work with them. They're trying to put little monitors in the helmets to see how many hits they get, from what direction they get the hits, and see if there's some evidence that they can use to prevent concussion. I think it's going to be rules changes and continued good coaching technique, teaching the kids how to, in football at least, how to hit and how to stay safe in that big violent sport. So one of the ways you could prevent sports injuries would be to get into a real training program. Have a plan and maybe even a program that you want to go to or an event you want to go to, and plan some steps towards getting to that. I don't want you to show up on Sunday for the half marathon thinking about it on Saturday and not having had any experience running, no good running shoes, no good outfits, no concept of what it's really about. So we really like some planning involved, some training gradually into that sport. We believe pretty heavily now in weight training. Like to see some our athletes and even our people trying to do exercise for health. We like to see them do some resistance training. We're big into having them do weights once or twice a week as well as their exercise program. So I think having an approach that considers some practice and building up to an event is the way to go. And then staying within your own limits.